Hi, Nurse Malika. This is Andrew, one of the RNs down in the recovery room. Are you ready for a report on Dr. Daniel's patient, Mrs. Angie Peters? Angie Peters, she's 54 years old, going to room 416, bed 2 on 4E. Her status is post-total thyroidectomy. She's doing well as of right now. Her blood pressure is 120/85. Heart rate is 80. Temperature is 37 degrees Celsius. And her O2 is at 97% on 2 liters. Right now, her pain is 2 out of 10. Surgery was remarkable for a large thyroid. No pre-op issues. She is a Jehovah's Witness, so no blood products were administered. She's also a full code, and her advanced directives are in front of the chart. We do have one safety concern, hypocalcemia. Dr. Daniels, the attending, ordered calcium levels every 12 hours because she's worried about possible hypocalcemia. So monitor pins and needles, muscle cramps, and shortness of breath. You'll need to review these symptoms when she's fully awake. As of right now, she does have normal saline IV running at 100 cc's per hour. Her meds are metoprolol 50 milligram. Prior to surgery, we just gave her 4 milligrams of morphine. During my care, the calcium levels did drop, so I did observe that. So the doctor did order calcium gluconate IV. But at this time, she is currently saline. Yes, so our urine output is good and Foley is to be DC'd in the morning. Yes. Good question. There are no known drug allergies.
Hi.
Hello.
Let me just perform some hand hygiene here and provide you some privacy. Hi, I'm Nurse Malika. I'll be your nurse for today. Can I have your name and date of birth, please?
Hi, my name is Angie Peters, and my birthday is January 27th, 1969.
Okay, great. Let me just scan your card. Nice. So, have you noticed any numbness or tingling in your fingers or toes, any cramping in your muscles or tightness around your throat, Miss Peters?
No, not at the moment.
Okay, I'm asking you these questions because very rarely after thyroid surgery, your calcium level in your blood can drop.
I see. Dr. Daniel asked me those questions in recovery, but I thought I was dreaming.
Yeah, it's easy for us to fix, but we can't let it get low. Calcium level that isn't treated has serious problems. If you experience any of these symptoms at any time, let us know right away, okay?
Okay, but this is making me nervous.
Dr. Daniels wanted to be safe. Low calcium levels are rare. They're easy to treat, but we'll check your blood tests. If any symptoms, we'll contact Dr. Daniels immediately. We just want you to be aware of what we're looking for so that you let us know, okay?
Okay, so tightness in the throat, tingling, and what was the third?
Muscle cramps, mother.
Okay.
Do you have any questions?
I don't think so.
Okay, here's your call button, okay? And I'll come right back in just a few minutes.
Okay, thank you so much.
You're welcome.
So this video is to show Nurse 2 utilizing the EHR2 assessment on ATI. During her assessment on Angie Peters, she utilized the neurological group assessment. At the time, Angie Peters was fully conscious. She is alert and oriented ×4. She was cognitive based on answering the questions. She didn't have any problems pertaining to speech. She had full acknowledgement of her situation. Nurse 2 also utilized the musculoskeletal assessment, asking if she is limited by any extremities. At the time, she was only limited with neck rotations. Patient complained of more pain during the gastrointestinal, genitourinary, and at the time her pain level was at 2.
Hello, nurse.
Yes?
Can you please tell the nurse that I'm having cramping and some numbness in my fingers?
Okay, I'll be right in, okay?
Thank you.
No problem.
Hello. How you doing?
Hi, how are you?
My name is Reggie. I'm one of the nurses here. How are you?
I'm okay. How you doing, Reggie?
I'm doing good. What seems to be the problem?
I'm having some cramping and some numbness in my fingers.
Ooh. Okay. Okay. Let me check your vitals real quick. Are you having any trouble breathing?
Just a little bit.
Just a little bit. Okay. Okay. You feeling any pain or anything?
Pain is about a 2 out of 10.
2 out of 10. All right. I'm sorry. Did I ask? Can you check your? Can you give me your name and date of birth again?
My name is Angie Peters, and my date of birth is January 27th, 1969.
Okay. All right. So right now, I'm just gonna check your respiratory real quick. Your pulse is a little bit high, so I'm gonna let the doctor know about that. Can you give me a deep breath in and out? In and out. In and out. In and out. Okay. How's your stomach?
It feels fine.
Any pain? Any achiness?
No, none.
Okay. Do you feel this? Do you feel me touching?
Yeah, I feel it.
Can you squeeze your hands for me?
Yes.
All right. What about your legs? Any tingling or anything?
I feel a little bit in the toes.
In the toes? Okay. Okay. Do you feel this?
Yes.
All right. So here's what we're gonna do. I am going to let the doctor know about your symptoms, and the doctor will come and see you. Okay?
Okay, thank you so much, Reggie. You are amazing.
No problem. No problem. I'll see you.
Okay, this is another video of nurse 3 utilizing the EHR tool assessment on ATI on the assessment of Angie Peters' current conditions. During the assessment, nurse 3 utilized the neurological assessment. Client was fully conscious. She was alert and oriented, able to make needs known. She had clear speech. And during her respiratory assessment, nurse 3 found irregular respiratory rhythms and labored breathing with inspiratory stridor and hoarseness, non-productive cough. She was currently on a nasal dilator 2 liters cover 2. During her cardiac assessment, telemetry showed irregular rhythm with a fluctuating pulse from 80 to 165. Client Angie Peters complained of pain and tingling in all 4 extremities. Client still continues to express that she has mobility, but still complain of limited neck rotation. And client continues to express that she has pain level 2.
Okay, Miss Angie Peters. She's complaining of numbness and tightness, and she had inspiratory stridor and hoarseness. And based on her lab, she got some critical lab values. Okay, let me just call the doctor real quick. Dr. Vallone, how you doing? This is Reggie on Unit 2B. How are you today? Good, good, good. I'm calling on behalf of a client, Miss Angie Peters. She's 54 years old. She has some critical labs. They are as followed. She has an elevated potassium, elevated phosphate, which is 7.5, elevated WBC, which is 14,000, low H&H, which is 31 and 32, calcium was 7.1, elevated CO2 28, low HCO3 11, low albumin, which was 3.2, and elevated hemoglobin A1C 7.4, and she also had a total cholesterol which was 300. Sure, I can tell you. Angie Peters is a 54-year-old Jehovah's Witness female that is a full code. She is status post total hysterectomy. We were monitoring her calcium levels prior to being up here. and it was stable, but now it went back up to 7.1. She had some manifestations of hypokalemia. She was complaining of cramping and numbness bilaterally, and we gave her they gave her calcium gluconate. During my assessment, she showed irregular heartbeats with inspiratory stridor and hoarsenesses. Would you want to start give her IV fluids, Lasix, with some insulin to help lower the potassium level, and maybe put in a endocrinologist, cardiologist, and a dietitian for the follow-up? Okay, will do, doctor. Thank you.
Hello, Nurse Reggie. Hi, yeah, I see that Angie Peters appeared to have a very high potassium. Yeah, so I'll start her on some insulin with glucose, also some sodium polystyrene sulfonate, and some loop diuretics, which is Lasix, to help lower the potassium level. We're gonna have to monitor her serum potassium levels closely and adjusting the medications as needed to maintain the normal potassium levels. We're also going to encourage her to follow a low potassium diet and avoid foods high in potassium. And would you also report any signs and symptoms of hyperkalemia, such as irregular heartbeat, muscle weakness, and nausea? Yes. Thank you so much. Bye.
Okay, this is a video utilizing the EHR tutor assessment tool, showing the MD putting orders for Angie Peters' current elevated elevated potassium level condition. As ordered, the doctor put in fusimide, running at 80 cc's piggyback, as well as some insulin to the IV push, sodium polythymine sulfonate, 1 dose orally, with directions for the insulin administer 10 units IV push with 25 to 40 grams dextrose. Give for the sodium polythymine sulfonate, give 30 ml liquid orally, and administer Lasix 80 milligrams IV times 1.
Hey, how you doing?
Hey, Reggie.
How's it going? How you feeling today?
I'm okay. I've had better days.
Oh, okay. Well, I noticed that your potassium level dropped now, which is good. I'm just gonna give you a little rundown of what happened. Your potassium level was a little bit elevated, and so we gave you some insulin and some glucose to help manage it down, to bring it down. Right now, we're gonna have to check monitor your vitals on the clock, as well as your intake and output. So, have you been drinking?
Yeah, I've been drinking water here and there.
Okay, good. Keep doing it. Okay. We're also going to change your diet. Okay, we're going to have a low potassium diet. Okay, so no bananas, no avocados, no potatoes.
Bananas are my favorite.
I know. Also no tomatoes and spinach. Okay, just for now, to make sure that your potassium level goes within the range, normal range. Okay. All right. If any symptoms or anything, weakness, fatigue, stomach pain, any rapid pulse, palpitations, let me know, okay? Or use the call bell.
Okay.
All right, I'll be right there.
Sounds good.
Okay, you have any questions for me?
No, you pretty much explained everything. Thank you so much.
No problem. You have a good day now, all right?
You too, Reggie. Bye.
Malika, can you help me with something?
Sure, I was just charting.
I'm having trouble putting a care plan for Angie Peters. I was wondering if you can help me with that.
Okay, sure.
I got all the information. I just don't know where to put it.
Okay, well, if we use Faye Abdallah's theory, we can filter out the data through the 21 nursing problems theory, the 11 nursing skills theory, and the 10 steps to figure out the patient's problems.
Okay, this is a video demonstration of utilizing Group 3 Faye G. Abdallah's theories of the 21 nursing problems, the 10 steps to identify the patient's problems, and the 11 nursing skills theories. Unfortunately, our theories didn't have a schematical diagram, so we developed our own schematic diagram through 5 steps. The first step was to assess the patient, identify nursing problems, prioritize problems, care plan, and evaluate outcomes.
Okay. And so, just like that?
Yep, that's the way to go about it.
Okay. Well, thank you so much, Malika. You're such a good nurse.
Thank you. Anytime. Can I go back to charting now?
Oh, yes.
Okay.